So one is sometime today, someone got a shot of vaccine in the arm, which represents 25% of eligible adults in the region getting at least one dose of the vaccine. So that's great news. We were also able this week to open registration to anyone eligible who's 16 or older in the region. So basically now everyone can pre-register for their shot, which is great. Yeah, so really it's a huge all hands on deck approach. So that's public health, but it's also every other healthcare partner in the region, the family health teams, the hospitals, physicians' offices, right through to our municipal governments at every, at the higher level municipal governments of the counties, the city of Guelph, the town governments throughout the counties, our private sector, University of Guelph. It really is an all hands on deck. We've got Linamar participating. You've got, municipalities pulling out hockey rinks so we can run clinics. It really has been everybody pushing for this vaccine program. And I think that's what you're seeing, right? We've got pharmacists giving shots. We've got doctors giving shots. We've got clinics happening throughout the county and in Guelph and on campuses and at manufacturing sites. It's really been everybody who can play a role in this has been part of making sure that every barrier we can knock down is knocked down, and we're doing everything we can to get vaccines in arms as quickly as possible. So let me describe how the vaccinations are working in this way. So we're still vaccinating according to the province's framework. So those three phases, phase 1, phase 2, phase 3, we're absolutely adhering to that. What we're asking people to do is pre-register right now. So pre-registering doesn't change when you'll get your vaccination, but what it does is it makes this process as seamless as possible. So what we don't want is we don't want to finish up all of our phase 1 or all of our phase 2 and then have a big gap while we start a next phase, or even groups within phases. What we want to do is keep this vaccination program rolling as quickly as possible and get needles in arms as quickly as possible. So by pre-registering, what you're doing is you're making sure that public health and the other vaccination partners have the right contact information for you, so that as soon as it is your turn to actually book your shot and get a needle in your arm, that there's no barriers in the way and that you're getting that shot as quickly as possible. So it's very easy. So you can visit our website, wdgpublichealth.ca/vaccine. Or you can also, that's to get more information about the vaccine. You can visit wdgpublichealth/register to pre-register. We also have a call center that you can use if you're having trouble with the internet or if you're having trouble registering online. But it's a very easy process. We're going to ask you a few questions. When you go to register, we encourage people to indicate the highest priority group that they're a part of. So if you are, let's say someone over 70, that's probably your highest priority. So when you look at the registration, they're kind of listed in order of where they fall within the government's phases. So we really encourage people to look at that list and make sure that they're getting themselves at the right spot at the list, because that'll ensure they get vaccinated faster. But it's a few questions. It's sharing your contact information. We don't want people to where we have had a little bit of issue with people getting a confirmation email, but I want to make sure people know if you get to the end of the registration, the pre-registration process, you are pre-registered. So even if that confirmation email doesn't go through, if you get to the end of the process, you're pre-registered. What I want to say though to folks is it's really important that people pre-register as soon as they can. What we really want to do is make sure we're getting to that number locally of developing enough of a herd immunity locally that we are protecting people. And so one of the best things people can do right now is get pre-registered. And yes, it will take some time, especially if you're sort of regular sort of folks without any other health conditions, any other criteria. It's going to take a while. It's going to take you into May and June, depending on how our supply looks. But pre-registering makes sure that we're getting the numbers we need and we're moving them through as quickly as possible. So as people are looking for a way to play their part in getting through this pandemic, getting pre-registered so that it's when their turn they can get a shot is one of the best things people can do right now. I do want to share with people, we're at a scary time in the pandemic. We're seeing numbers go up. We haven't seen the numbers from Easter weekend. We've all heard the stories of the pressure on our healthcare system right now. These variants of concern are no joke. they are more transmissible and potentially more serious if you get one of them. And so we all need to follow public health guidelines. We need to keep wearing those face coverings. We need to keep avoiding gatherings. We need to keep practicing physical distance, because while we see the end in sight with these vaccines, we want to make sure we get all of us to the finish line. And so it is the combination of people's willingness to still follow that public health guidance and vaccines that get us to the end of this thing as safe and as whole as possible.